Hi, I'm Dr. Ray Wisniewski, America's Healthcare Answer Man. We're here to talk about treatments for degenerative disc disease. But first off, let's talk about what causes this. How do we get degenerative disc disease? Number one, there's only one reason. That's increased mechanical stress upon the disc itself. It's this increased stress similar to the front end of your car being out of alignment. That misalignment puts more mechanical stress on one portion of the tire than the other portion. And like the tire, it just wears down, and that's what happens in the body. In the same way, when we see it on the front end of your car, you'll see one portion of the tire looks perfect, the other portion is worn down. In the spine, there's 24 vertebrae. The disc is between each of those. If there is a misalignment, that will wear down. And so they're all the same age, yet you'll find usually one or two areas that'll be much more worn, and that's where we have this disc degeneration. So number one, first thing we need to do to stop this is to correct this malpositioning of the misalignment within the spine. And we do that with a structural corrective chiropractic adjustment that's going to specifically realign that spine so that we decrease that stress within the vertebra. We want to take an x-ray beforehand, we want to make the positioning corrections, and then take an x-ray afterwards to determine the amount of correction that we're able to obtain and to see if we're going in the right direction. Next, we need to rehydrate and regenerate that disc so that instead of that disc wearing down, unlike your front end of your car with the tire, once it wears, that's it. In the spine, your body's constantly regenerating new cells. And it's this regeneration that when that next cell is better than the one before it, that's regeneration, versus when it's worse than the one before it, that's degeneration. Now, to allow this to happen, we're going to have to do a specific type of traction that's going to cause a pumping mechanism. And that pumping is going to bring fluids into the disc and rehydrate it. In this particular mechanism, with, for instance, the lumbar spine, we're going to use a flexion distraction. In the cervical spine, we would use a specific traction that allowing us to maintain that cervical curve. But we need to use a specific traction that's allowed by a structural corrective chiropractor. So you want to really see a structural correction chiropractor. The next thing is that we need to give the body everything they can to allow that body to regenerate. So that means our proper nutrition. The nutrients that we're going to use will be Boswellia serrata. We'll use a proper pH. We need that first morning pH between 6.4 and 7.0 because we want to maintain the good calcium. That's what's referred to as the soft tissue calcium. That's the monoortho calcium phosphate versus hydroxyapatite, which is from the bone. That's going to create more spurs, so we can stop that. Next, we're going to use things like glucosamine, N-acetylglucosamine. We can stop the free radical formation, what I like to refer to as cellular smoke from the cells that are degenerating that creates these free radicals. To do that, we're going to use Super Nano green tea. That's probably one of the most effective and efficient antioxidants when dealing with the discs and the cervical or lumbar spine. So those are the treatments for this. And when this is accomplished, we can totally transform your life, stop the degeneration, stop the pain, and allow this to actually be reversed and be healing instead of degenerating.